When we first applied for a personal health budget, we had to fill in a care and support plan. And we were given 3 different plans with no guidance as to how to fill them in. And we found that really very difficult. We were very fortunate in that through the co-production group, we were able to attend a 2-day course called Planning Live, which was run by Helen Sanderson Associates. And on the 2 days, we worked with a facilitator to produce a care and support plan for our daughter. And we found it extremely useful. So after the course that we went on, we were able to go back to these 3 different plans we'd been given, and we were able then to personalise them and fill one of them in. We chose one of them as no one else was telling us what to do, and we managed to fill it in so that it was very personal for our daughter, and it really brought her into the centre of her plan rather than all her medical conditions.
Well, I think if a person owns a plan, if it's been done with them rather than to them, which was often the case in the past, it was done to them. People were, CPN would come or the support worker would come and give them a piece of paper and say, this is your care plan, sign here, with no input from the person themselves at all. I've known that happen on many occasions in mental health. But if the person owns the plan, and if they have had a big input into producing it, they're actually more likely to stick to it. They're more likely to take the medication. They're more likely to do the positive things they need to do in order to remain well and have good outcomes, because they own the plan. If the plan is imposed on them by a professional, they're less likely, I think, to follow it. If they own it themselves and it's been done in a sensitive way, they are more likely to follow it, and that will obviously lead to better outcomes for them. So I think that's one reason. There are many reasons why personalised care planning is important, but I think that could be the main one, that they will stick to it if they own it. If it's something that's been imposed on them by a professional, they're less likely to do so.
To make the care and support plan personalised, you must have contact with that person. It's no good basing it on experience from other places, from your actual professional qualifications alone. It has to be based on the experience you have with that particular person. So if that means getting the information from relatives, friends, people who are just acquaintances even, all that has to be put together along with anything the person themselves can tell you.
Personalised care and support to me means putting the person at the centre. It's about that balance between what's important for a person, what's important to a person, but making that real balance between the 2 things and taking into account everybody's needs, their wants, desires, their aspirations, and working with everybody around that person to support their needs.
The care and support plan was so important in the whole arrangement for personal health budgets. We felt it had to be really personalised to our daughter, that actually didn't necessarily concentrate on her medical conditions, but was really a sort of holistic picture of her at that time.
I think one of the most important ingredients of a care and support plan is that the person takes ownership of the plan and, if possible, actually writes the plan themselves. If they feel they need help, then I would suggest that they work on the plan with somebody that knows them really well, so that they can produce a plan that is for that person and includes the person's wishes and how they see their life going forward.
Well, I think the absolute key ingredient in the singular is the input of the person who is being cared for or looked after or treated. That's the key ingredient, their input. Everything else, I suppose, is probably secondary to that in my view. That's the key ingredient, but it should be holistic in that it doesn't just look at medical needs, but looks at social needs, environmental needs, physical health needs, mental health needs, medication, And it shouldn't just be all medical, it should be around the whole person, their friends, their family, what they like to do, how they want to live their life. And it should all that should be written down and put into the plan with the person.
The key ingredients to a personalised care and support plan is about what matters to the person. It's about getting to a place where you can be absolutely clear what that person is trying to achieve in their life, their aspirations and goals, and that clear outcomes are set and agreed by everyone involved in that person's care, health and support. It's about involving everybody and looking to the future.
It's very important that within the plan you readily identify what's important to the person, what's important for the person, and from those you can set your goals. Yeah, you also need to know what's working for the individual, and probably more importantly, what's not working for them. So you can actually work again to set goals that achieve those ends.
The plan should bring the person to life. They as a person should shine through the plan.
Well, I suppose, again, the fact that it's been what I would call properly co-produced with that person, that it's not been actually just written by a professional and handed to the person and said, this is your care plan, sign here. Because I've known that happen on numerous occasions to friends of mine, people I know.
There really must be an overarching plan, one single plan that covers all aspects of the individual. It may be necessary if there are specific disabilities that need to be addressed, then there can be bolt-on parts to that plan.
If I was going to say one thing, it would be very simple. I think they should be working with people, not round people. Can you say any simpler than that?
You know, that input being recognised and listened to and incorporated into the plan, the more of what the person wants from their life, the more of their goals, their aspirations, their hopes, their dreams that go into that plan, the better it will be for them.
I think personalised care and support planning is important because it means that true outcomes can be pulled together to ensure that the needs of the person are being met, and that those outcomes are designed with the person, and that everybody is clear as to what the end goal is that is trying to be achieved. The care and support plan, if it's truly personalised, will take into account all the person's needs, what can be done, and how they can support the person to get to what's important to them, not just what's important for them. If I could say one thing to services that provide care and support planning, is about involving the person in that conversation, and that person owns their plan. They might not necessarily have the original copy, because all the services that support that person might need to have access to that, but it's about them feeling and perceiving that they've really took a part of shaping that plan. They own it, it's about them, and that it's absolutely clear about their needs and the support they're going to get.